Oh, to like kick you?
Yeah.
Great. Hey, good morning, everyone, and welcome to our special town hall to talk about DOH 1 DOH and some of the course corrections that we talked about in the email that I sent out maybe 2 weeks ago now. So I want to welcome you all for this, both here in the room. We have a great crowd in the room, and for all of you who are watching us across the agency, either in conference rooms or at your desktops, welcome. It's great to, I'll wave. We're glad that you had an opportunity to join us, and for those of you who might watch this on tape as well. So I thank you for your interest. I think everybody here, I believe, knows that I'm John Weisman and the Secretary of Health, but I wanted to give an opportunity for the folks up here to also introduce themselves. And the reason they're up here is they're part of the project team that Jessica's going to talk more about in terms of organizing this. So Jessica, let's go around this way with introductions. So you want to introduce yourself?
Okay, Jessica Todorovic. I am the Chief of Staff, and for today, I am also leading the project work that John has outlined.
Courtney Dutra. I lead the Employee Services team, so representing questions from Office of Human Resources and Facilities.
Drew Boughton, Director of Policy and Legislative Relations.
Amy Ferris, Chief Financial Officer with the Office of Financial Services.
Clark Halverson, Assistant Secretary for Environmental Public Health.
Petula Burks, Director for Center for Public Affairs.
And I'm Jared Davis. I lead the Division of Disease Control and Health Statistics.
We're going to have another person pop in who's got to run to interviews, so she's here for 15 minutes.
Hi, good morning. I'm Kristen Peterson, Assistant Secretary of the Health Systems Quality Assurance Division.
And on the phone with us, we have Jana Barty, who is not able to be with us in Olympia today, so the Assistant Secretary for Prevention and Community Health. And then Michael Lair is on vacation today and not able to be with us. So this is the project team leading this effort, and I wanted you to have a chance to meet all of them, and they may have things they want to contribute as well during this conversation. So before I jump into the topic, first of all, I want to say, wow, folks, legislative session ended on time yesterday. We sine-died is what they called it. It was a short session, and I must say, I just want to actually start by thanking everyone for the work that you all did during session. It takes a lot of people to work this process, people who are doing policy analyses, people who are writing fiscal notes, people who are preparing and giving testimony in front of the committees, all the different staff questions that come in. I know I don't have the answers, and they all get sort of funneled out to you all, and really appreciate your getting those. And then the stakeholder meetings that go with a lot of this work where we are trying to work out bill language and get to some kind of agreement. Tons of time and effort goes into that. Some of those actually result in bills passed, and some of those, sadly, result in bills not passed. I mean, sometimes we don't want them to pass, but the ones we do, it's sort of disappointing when we put a lot of effort into it. So just thanks to everybody about that. We'll probably do and Drew, thank you for your leadership on this as well. So we'll do some more follow-up around what actually happened from legislative session in terms of bills as well, but we'll do that at another point in time. I want to start out on this topic of 1 DOH by acknowledging sort of any time you make change, there are unintended consequences. Certainly, for some folks, it can be stressful about what does this all mean, especially as we do this earlier, where we're trying to be more transparent, where we're not coming with we have all the answers. So I understand it can be stressful, uncertain. It can bring up past experiences with change we've had that maybe either didn't go so well, or for some of us went really well. And so we have a whole range of people who are either excited about this, not quite sure, or not only no, but hell no. So I recognize that there's a range of actions or responses. And so we did want to have a chance to be able to talk with you all, answer questions, and tell you a bit why. And that's one of the questions I think we've heard a lot from folks is why. So first of all, I guess I want to start out by saying that when I look at our jobs, I am very aware that Jobs for us in terms of our personal interest, we want to make a difference. A lot of us have passions about our work, whether it's specifically a particular area that we might be working in that's topic specific, or our skill sets, whether it's about communications or health promotions that isn't even topic specific. It's just we have a passion for that work. And that's that passion that I want to keep alive as we move forward. We also want to work, I think, in a really good environment, an environment where we feel respected for who we are, where we feel like we can get our work done with the fewest barriers out there, the fewest hoops to jump through, and sort of that nonsense stuff that we know happens. Sometimes that's a part of hierarchies and just being part of state government, but sometimes it doesn't always have to be that way, and a lot of times it doesn't have to be that way. So we're looking for that good environment to operate in. And honestly, we want fulfilling relationships with our colleagues, I think. I mean, we spend a lot of time together. When I'm working with Jared, there's a piece that I'm getting about fulfilled relationship and just another person who sees things another way, comes with his own passions, and it's bringing those things together that I know motivate me, and I suspect it motivates a lot of you. So for me, this change, I see my job as secretary in part to help make sure that that's the environment we're creating in the organization. That we have an environment where people can feel that their personal interests in their jobs is being nurtured, valued, that you are working in an environment that supports that, and that we can work well together and appreciate our relationships. Part of this change for me is wanting to make sure that all subject matter experts feel like they have a place at the table and are valued, and that subject matter experts aren't having to do the work of other subject matter experts that really aren't our own expertise. Part of this is that I know the demands on us are high. Whether it's external demands that we get from the legislature. I mean, we just had legislative session. There's a whole lot of stuff we're going to have to do now because of that happened from the legislative session on top of our regular work. And some of it is, we're like high achievers, right? I mean, that personal sort of feeling we have for our work. So we hold ourselves pretty high as well. I want us to be a bold and strong organization, because the future is going to require that we be our best as an organization, not just as individuals, but as an organization. And we do some of this really well. I see it. I see when we are just clicking along, whether it's around the opioid project, where we form a project team. Sometimes we form these teams a little too late, where people are a bit frustrated and pulling their hair out, or lead work, or other things we've done. So my job, I think, is to help create an environment where that can happen the best. Now, I will say that, and this is well before I've been here, because when I did my first interviews with staff, where I did some key informant interviews, I learned and heard a lot from people about, look, my subject matter expertise isn't respected. Whether that's sometimes maybe I'm an epidemiologist and people don't respect that, or I'm a communications person and people won't listen to me. I'll use epidemiologist since I'm one, well, technically one. Like, I said I can't calculate a p-value or confidence interval, save my life. So I really probably am not a current card-carrying epidemiologist, but there are things that are important to all of us in terms of communication. But truthfully, how we do communications, there are experts in that. Whereas an epidemiologist, I kind of need to just make sure that the sort of factual stuff is right, but how that gets communicated, other people need to help us with. And so I've heard from staff that disrespect from the day I got here. And I heard frustrations with decision-making not working well, or who gets to make, what are the roles and responsibilities. We operate very much in a matrixed organization. And I've tried to work within that matrixed organization now for 5 years. And I'm still seeing a whole lot of frustration in these areas. And I see it at my level because it rises. I see it when assistant secretaries are needing to describe the frustrations that folks have with the matrix work that is not working well. I see Jessica as the chief of staff needing to work through those things. And so I decided that it was time to say the matrixed part of these cross-cutting functions, especially around some of the communications, the policy work and budget, just aren't serving our organization well. They're not letting us be the boldest and strongest that we need to be. And I'm not seeing people feeling like they're being fulfilled. And, you know, this isn't, I don't want to be a downer on this and say nobody's feeling this and that we never do it, because I do see when it happens really well. But that led me to believe that we need to make a different decision. And the we was me, Secretary of Health. That's my job, is to sort of observe the organization from the highest levels. And I don't have every single data point in this organization. None of us do. We all have pieces that we see. And from my level, I've seen that we've tried to work within a matrix organization. We've given it really our best effort over 5 years, and including, you know, bringing up the Center for Public Affairs. We did not make a wholesale change. We tried to work within sort of a matrix part, and I'm just saying that that isn't working for us. And so now that some of the leadership, the direction and supervision on those cross-cutting things has to come from one place in order for us to, I think, do our best. And to really be all that we can be as an organization. So some people have, I think, felt like, God, John made this decision. He was really angry. We're failing. It isn't working. That's not how I see it. If anything, I was frustrated with myself in sort of not making this decision sooner, because I see some of the spinning that's occurring, and we're getting stuck, and people are needing to spend time on things that you shouldn't have to spend time on in terms of these interpersonal subject matter conflicts, and that we have some risk in the organization. And risk in the organization, I'm certainly tolerant of risk. I want us actually to be bold and try things differently. I want us to take risk in terms of public health. Where I don't want us to take risk is where, sort of from an operations perspective, things that we should have caught. And if we see that happening across the organization, that we've got to make a change then. And that's some of what's happening on the budget side. We certainly, I think both at division levels and at the executive team level, don't have that line of sight back and forth around budget as much as we need to. And there have been some risky things that have occurred where we're in trouble with some of our funds, and just not particularly anybody doing anything just from a place of malice or anything. But when we go to OFM and they see this happening here and this happening here in the organization, they're like, well, do you not have insight into this? Do you not have control? And so what we're trying to do is on these cross-cutting things just get more streamlined and have that centralized leadership and direction and oversight. It still takes all of us to do all of this work. So no, I didn't make this out of anger. I made it out of a place of trying to help us do more of what we do well. So people also, I think, want to know, what are my success measures? And this will be the last thing I say. Then Jessica's going to either say anything that she thinks I might have missed that she wants to say, but then briefly talk about the project. Then we're going to open it up to your questions in the room and also from those of you who are watching this via the web. So success for me, one of the things I'm going to look at is the employee survey results that we do every year. We actually do look at those, folks. And if this works, I should see better job satisfaction and, frankly, people feeling like they have more control over their work because it will be clear about what it is we're supposed to do. So I will be looking at those employee surveys, and we've been looking at those. We look at those by division and sort of know where there's more satisfaction and where there's less. I will I will hear from folks and see more respect for each other's subject matter expertise. And I will see us clicking better where people are spending their time sort of operating at their highest level, and as an organization will be more productive in getting more things accomplished. I'll see more project teams that are coming together, that are forming, where we are actually working together, bringing that expertise all throughout the organization. When I'm walking around, I will see more of that. And we'll have this outward mindset where we're really asking and seeing, what do others need? What do others need? And that we will adjust our efforts when we're becoming inwardly focused and not realizing that we're really not meeting the needs there, and that we'll be able to measure that impact. Those are some of the things that I will be looking at. And I admit some of those are qualitative, but it's a mix of quantitative and qualitative where I think we get the whole picture. So that's what I wanted to say at the outset, that I hope responds to I know the angst that's been out there over the last 2 years. Change does bring that up often, and it is a natural part of change. But also some of the questions we've been hearing, and I know we'll have a lot more conversation about those. So Jessica, anything I missed, and then a little bit about the project?
I just wanted to talk a little bit, I think, about the project. I think you summarized the why really well. So we have launched the project leadership team, as you see here. We also have Ashley Daniel as our project manager and Michelle Osmonley in communications for us on the project as well. So we're trying really hard to think through, and we're working on getting a change management person. We're trying really hard to think about how do we incorporate good communication and change management throughout this project. Today, I just wanted to walk you through the basic steps so you'd start to see what this looks like. I know one of the things that's hard when you're feeling stressed about change, I'm stressed about this change and I feel this, which is we don't have all the answers yet. We brought this out and we shared it at the very beginning stages. And so by sharing with you kind of the steps of the project, I hope you'll start to get a sense that we really are in the beginning. And we've got lots of work to do in a pretty short time frame. So we are starting with the visioning engagement. This is all about creating the vision of the future in these areas. We're calling it an engagement because there's going to be lots of engagement, lots of participation for subject matter experts, people who do this work, focus groups, just an opportunity for giving input into the vision of the future. Where do we want to be in the future in these areas? Then we'll go through an assessment phase where we identify from the visioning, the functions and the capabilities that we need in that future vision, and where are we at today? Where do we have gaps? Where do we need to? So I'll just give one quick example. I use this example just to try to make it simple. What if in the visioning we decide we're going to have a TV station? That's what we want. We need a TV station to do communications well. And then we need to say, okay, do we have anybody who can run a TV station? Do we have a facility for a TV station, right? That's kind of the assessment part. Then the next part is really that gap and changes. Okay, in order to make that happen, how would we go about getting a TV station? How would we procure a station, people who know how to run a TV station, a producer, all of that stuff. That's really where a lot of the HR pieces come in, where we start thinking about how do we create the organization that would support this with the direction John's given about where the leadership is going to come from. From there, we'll create an implementation plan where we start to say, okay, based on that, how are we actually going to get there? And one of the pieces I want to say is, as we think about this, the project leadership team's well aware that we may not have an immediate, by December, we will be able to implement the entire future vision, for DOH in these areas. I'm guessing if we decided we needed a TV station by December, we wouldn't have it. So there may be multiple phases of implementation. So just starting that implementation planning and thinking about what we can do now, what we can do later, and how do we, build that out. And then we will do the implementation, and then we will do the evaluation. So those are the basic steps of the project plan. So you know where we're at. We have just started outlining the visioning engagement. Drew, Amy, and Petula, who are leading those projects, are working on developing that plan, and the project leadership team is going to be working on how do we connect the right folks into the engagement process. So, how do we get people on teams and on focus groups and in interviews so that we can collect that information. So that's where we're at with the project. We're open. You see the team here along with Kristen, Michelle, and Ashley, and Jana, who's on the phone. You don't see her, but she is on the phone. Anybody can take feedback, input. If you have questions, please find any one of us, and we can help share kind of where we're at in the process. Our plan right now is to do updates every 2 weeks. We feel like that's a good chunk of time that we'll be able to share progress on this work. We're hoping to do some videos about it, especially as we get to the visioning part and kind of share what that looks like. And then, emails and daily dose articles just on the basic steps of the plan. So that's kind of where we're at today.
So Jessica, we'll go to questions here in a second. I'm going to give you guys a heads up. We're not wanting to be talking heads, but I want to just make sure if there's anything on top of your mind, team, that you feel you want to quickly say, I want to give you a chance to do that. Then Jessica, do we have any questions that have already come in from the...
No, we do not have any questions yet, so please start typing. Oh, yeah, here we go.
Okay, great. Because what we're going to end up doing is I usually start taking questions from in the room, but we'll take the first one from our folks who are all across the agency, and then we'll come to the room and probably go back and forth. So, team, anything that you want to add at this point? No? Good? All right. So what's that first question that we've got online?
Okay.
And if we don't get to all questions today, folks, we're capturing these, I believe, and we'll make sure we get answers to all the questions.
So as a program staff person, my experience with communications is that my program and my SME is not something they have intimate knowledge of. Plus, there has been a lot of communications turnover, which prevents the communications folks from really learning about it and understanding the subject. And my understanding that the One DOH project is intended to standardize all of the communication folks, and if so, how will they be able to work with program staff if they are further removed from the intended outcomes and the relevant stakeholders for the program?
Great question, and I'll start with that, and others, if you have additional things to ask, go ahead, or to answer that, go ahead. First of all, subject matter expertise is critical. And I'm not expecting any communications or health promotion person to know all the content. That is not sort of their job, is to know the content. This is that team place again where folks have to come together. There are things I think we want to standardize across the agency in terms of communications, and to be able to make sure everybody has access to the kinds of innovation that some programs have access to simply because their grants or whatever are able to pay for that. So we want to, I think, give people the ranges of ways to communicate and the tools to do that. And that's where health promotion and communication folks come into play. And they can bring in their theories, their knowledge of change and how you communicate with the subject matter experts. So this is that piece, again, about respecting what we each bring to the table, as well as making sure that that resource, that range of health promotion resources, that range of communication toolkits is really available to every program in the department. And that's that piece about where I'm trying for us to actually magnify what's working in pockets in the organization. I hope that answers anything. Anyone else want to add to that? All right. How about, so we've got mics in the room, so we'll take a question over here. Are you doing the mic? Right, okay.
Hi, I'm Joe Mahelich, the Chief Shop Steward here for the Department of Health. Thank you for your vision that you've had and the change of culture here at the Department of Health for your last 5 years. I mention every time in our new employee orientation, our labor part of it. This appears to be a very big reorg. In the last 10 years, there have been many reorgs. I would probably say about 15 in certain divisions. And there have been several big campus moves, and we've got another one coming. With this one approach, will this be the last big reorg for a long time? And also, do you anticipate any net loss? And will any union member, either through council, through the Washington Federation of State Employees, or a shop steward like myself, will be on these committees like you did for succession planning?
Great questions, thanks. And if I don't get to all of them, remind me what they were. Let me start with, first of all, with this process, we're not seeing any layoffs or any impacts to like people needing to leave the organization unless they so choose that like this isn't where they want to go. I mean, that's a personal choice about that, but this isn't about downsizing or anything like that. We're going to need all the resources we have in the organization, and frankly, to do this in the long run, Visions will probably need more resources as we go into the future. Yes, reorgs happen frequently for various reasons. There's no way I'll ever say this will be the last reorg that happens in an organization. I couldn't promise that. I can't really see out always to that piece. But what I do want us to do is comes back to something Jessica said, in which we recognize as an organization, there are two things certainly we could do much better. One is we could do change management better. There are sort of models out there about how to do change management, and we haven't really been using them well. So we know we need to get better at that, and we need to have some resources to help us do change management. We also have to do project management better, and we've been hiring some project managers, and I think having really great success with that, where we can see sort of timelines, milestones, and we can have people who actually, that's their expertise, that's their subject matter expertise to help us be successful. So those things, I think, will help us as an organization better manage when we do have organizational changes, to do those better and be more efficient in them. I will say, I think every time we think about doing an org change, we do have to ask ourselves why, right? And what are the potential unintended consequences? And I think in working with the union, we've got, I know, a list of questions, I think, as we're going through these processes that we've agreed we want to answer. And so we remain committed, I think, to doing that. So that we're being as transparent as we can be, Joe, and that we're thinking ourselves about what's the real purpose. So this purpose of this change and this operational plan, it's really, I see this as a course correction. It's actually doing more of what we do well and trying to let go of what isn't working so well. So and as I've said, there are tons of data points in this organization, and I don't have them all. That's why what I felt like I needed to do as secretary was say, look, this matrix kind of work that we're doing hasn't been working for us, but how to operationalize that takes the people who know the work. And that's why we've got a project team and why staff will be engaged in this. Did I get all the questions?
Will the union members be a part of
that? Yeah, absolutely. This will be staff from all parts of the organization engaged, management and union. Yes, thanks. Amy.
So I would just add, like John said, it is important to have all levels engaged in this. We want to co-create this together. So I think we need that engagement from all the folks that do this work or need this information or this service. So I do think it is valuable that we have that.
It's not just valuable, it's essential.
Yeah.
Yeah. Do we have a question online by any chance?
Yes, we have lots.
Yeah, okay, great. Lots of questions online. Thanks to you. I think there are like at least 400 of you who signed up for this or something, so.
Okay, will there be a work plan, framework, or charter that we can see online? Absolutely. We have a SharePoint site we're standing up. It'll have the charter, which we're almost finished with. It'll have, in each phase of the plan, it will have kind of the outline of what that plan looks like. We'll have notes out there. We'll have documents, anything that's created as part of this project. It'll be out there on that SharePoint site. So we'll be getting that out to you as soon as we get the charter done and have something to put out there on the SharePoint site. So keep an eye out on that. How does one DOH square with John's desire to empower decision-making authority as far down as possible?
Great. Yeah, we've heard this question as well. And so I think sometimes people think of decision-making as central or program, and certainly that's that's a piece of decision making. When I talk about decision making and pushing it down, I think more about sort of levels in the sort of management structure or hierarchy in that sense. So at both the central services that are centralized and services that are in programs or whatever, you have people at sort of similar levels. And this is about getting decision making where you can at the lowest levels of each of those. Some of what, when I talk about the decision making at the lowest levels, it's about what it is you need control over your daily work or the things to get your job satisfaction. And what I sometimes, and I often hear from some staff is, look, in order for me to talk to somebody over here because I need to engage them with my job, I've got to go through my supervisor who has to go through their manager, and maybe it has to go to the assistant secretary over to the assistant secretary over here and then down. That has to stop. People who need information or have information to share with someone else to help them be successful, we've got to allow that easily flow of information. So in part, when I talk about sort of pushing decision-making down, that's one of the things that I'm talking about. One of the things that I've learned since I've been here as well, I think, is we have to think about what are the right levels of the organization for certain decisions to be made as well. And that's maybe where we have not been as good about I haven't been as good about communicating. Yes, there are some budget decisions that can be made at a program level about a particular grant, and we need more funding over here for the communications materials of our grant, and we had a vacancy in staff, so we need to move that. And yes, work with your project officer wherever to get those things approved. Those are things that empower you to do your job. Some things, though, that should be at the higher level of the agency is like when we have major general fund allocations and resources that we need. That's something that we have to have a better insight into at the higher levels of the organization. And it's one of the things I asked the public health operations team to do, is to really have those conversations about where is it we know we need more resources. How do we get those, and how do we prioritize those? I'm actually looking for that team to do that. They're closest to programs, they're closest to you, and they can also do that cross-cutting look. So the pushing decision-making down is multifaceted. It's not just like pushing down from central to programs, it's what level in each of those are decision-making getting done so that people are empowered to have what they need to get their job done, and the people who have the expertise to be able to, make decisions. And then that piece about where there are cross-cutting resources that we need to look about, or risk that we need to be thinking about in the organization at a high level, making sure we're clear about where some of those decisions are getting made. So I think we'll keep working on that, but and frankly, what I'm excited about is continuing to build this capacity for project teamwork, this multidisciplinary project teamwork across the organization. There's a lot of power in there. If you are given a project and said, these are the resources you have, now manage it, or this is what I need is resources, so that we know that if there aren't enough resources, then we can help sort out how we get those. That's I guess, what I'm looking for. And we're doing this in pockets again. I just want to make it the best practice across the entire organization. Question maybe in the room? Anybody in the room? Great. Okay, we'll come to you next. We got one in the back here. We'll get the back first and then come up front.
My name is Noelle Parrish. I'm the finance coordinator for prevention and community health. And I just want to say thank you for taking the time to look at the organizational assessment and make your decision. Also, just want to bring to light that the we are still dealing with, we are still working on organizational structure and change, like in our budget and in prevention and community health altogether, and are still, and a couple others stacked on top of that over the last few years. And so I just want to bring up, please consider, this is a very aggressive implementation plan timeline, and mid-biennial changes can really highly impact, the finances and the people who are actually doing the work in the fiscal arena. Chart of accounts type of accounting stuff is very stressful, and we've had a lot of lessons learned around that. I also would say that I used to be the budget and operations manager for the chief scientist of fisheries, and we talked a lot about stressors and the impact on health and impact on socialization, just of the fish, right? And I just want to say I've been with Department of Health for 2 years, and I see that there's a similar thing going on here, where that paralysis, or like what you're talking about as far as not knowing where to go and stuff like that, has to do with the constant change and reorganization without proper change management. And so please consider that. Please consider, prevention and community health are especially, all the people who do finance and budget and the and HPCS, but finance and budget has a long way to go as far as everybody getting on the same page, and everybody and kind of our chart of account standardizations and all of that stuff, And so we're still working with management, to really iron out those kinks so that we can give accurate quarterly variances for Amy, and I think that's what I was going to say, but just asking about the mid-biennial changes, the aggression, the timeline seems like that doesn't seem really realistic if we're talking about an implementation plan being done by July 1st. So please consider that.
Yeah, let me clarify, I think, some of what we're talking about as well. So thanks for sharing that. And that standardization you're doing is exactly what we want to support in the organization, where we are getting standardized processes, much like in the health transformation world, where we're trying to lean things, get rid of waste, but also get consistency. And that sounds like exactly what you're doing. So applaud that effort. What we're talking about is getting this sort of planning work done in like the 60-day time frame that I gave staff, and so that isn't implementation. Implementation will some things we'll probably be able to implement quickly and early, and other things we may have to delay and say, well, the right time to do this is at a biennium change or whatever. So the implementation plan has to make sense for the conditions that matter. And again, those aren't things I particularly know. It's the things you guys know. It's the things these people here know. So implementation plans will vary, and what gets implemented will vary at different times. So it's got to work well. So.
And the other thing that I'll say as the project lead is that we are not going to sacrifice engagement for the 60-day timeline. I'm not going to. So I'm happy to let John know that it might be 65 days. It might be 75 days.
You let the cat out of the bag.
If that's what it means to have the right level of engagement. And part of our challenge is we're just still trying to build that system out. So just keep that in mind. John knows that if we are working on the right things, then if it takes a little bit longer, that's not going to be a deal breaker. So just keep that in mind. We're not going to sacrifice that for the 60 days. Yep. But we feel the urgency to move this forward, and we will keep that in mind.
Maybe a question from online, and then we'll come up here.
Okay. All right. When did you begin to call this a project, and what does that mean to you? And the same person asked, do you have a list of desired outcomes that is informing your visioning? If so, it would be very helpful to share this. So I think the project part of this is what I described, which is the operationalizing how we're going to get to what John has asked us to. He's laid out the vision. We're trying to walk through a process to get there. That's, in my mind, what I think of as the scope of the project. We do have a list of desired outcomes. They were in John's email. We have done some work to add into that. That'll be part of the project charter that hopefully will be available, like today's Friday, I would say mid next week. So we should have that out there very shortly with a little bit more detail. But if you kind of go back to John's email, it really talked about what his vision for One DOH is. And that is, as our project, that's part of our outcomes that we're looking for. And then how do we operationalize that? So there's a question.
And I will say too, on the One DOH, so we started, I think the question is maybe when did we start this project? It was, a decision was made 3 weeks ago that I needed to do this. Something like that. But the One DOH piece, I started with what it was I was looking for when I brought this team together to talk about the decision. We also looked at that a bit more and played around with it. So we modified it based on our discussion. And so in that sense, I think we all own that as the project team. Question?
Yeah.
Finally, you get the mic.
Hi, I'm Elizabeth Turnbow, and I'm the union rep for the Washington Federation of State Employees. I guess my question is, when you were talking about working with our union members, you had a list of questions you kind of referred to, and as I hear you outline this, I have a list of questions too.
Great.
The thing, though, that I really am most curious about is, how do you define a subject matter expert?
So good question, subject matter expert. Subject matter experts range from what's coming in my mind is clerical staff, but that's not the assistants, who have subject matter expertise in software packages around word processing, for example. That's a subject matter expert. A subject matter expert in terms of how you organize projects is a subject matter expertise, oftentimes project management. So frankly, everyone in the organization has a subject matter expertise of some sort, is what I'm saying. And it's about how do we bring those together to both value that and say, I need to hear what you have to say, and not only just hear it, but really take it in.
Yeah, because I see a lot of our members are subject matter experts. They're the frontline staff. They're the folks who implement a lot of the vision. But it's been our experience that often the vision, the plan, the implementation gets going, and then we hit an obstacle because we didn't ask the person who actually has to do the work if it's going to work. So my hope is as we move forward in this, that I know that we have lots of formal avenues to discuss things, but I really hope on an informal way that we're able to kind of work together and, come to agreed upon outcomes that benefit everyone.
I think did you want to say something,
Well,
Jared?
one of the things I want to say is that I think the work plan that we come up with has to be grounded, and we need to have the right people on these different teams in policy, budget, and communications, and that means at all levels of the organization, and the folks that are doing the work at the ground level, and those that's just necessary for us to be successful. So that's definitely going to be a part of it. We're starting to think about identifying names in those different categories that are going to really lend credibility and help us have a really sustainable plan forward. So.
And there was something I was going to say about this as well, which has left my mind. So if it comes back, I'll share it. Ingrid, I think, has got a question, and then we'll go back to here, and then we'll come back to the room.
Ingrid Hansen, shop steward, and also one of the writers of the union list of questions. If you're curious as to what they are, they're on the HR website, and they are a list of 23 questions that we asked the secretary at one of his earliest Union Management Communication Committee meetings to assure us that if DOH was going to do a reorg, along with the letter announcing the change in organization, answers to the questions would be provided at the same time. And has that ever worked well? sometimes we get through the opening questions and we can use those because they're meant to develop our understanding of what the heck is going on and why is this agency reorganizing yet again. But since I'm the one that's actually sat in on most of the 30 or 40 demand to bargains, I've got a certain level of expertise. I'm very excited about this change, mostly because I'm hearing how much you're addressing the desperate need for lean practice improvement in this agency and a true orientation to project management, which has a huge scope of addressing needs from our community, assuring success, bringing the people to the table who need to be there. The thing that I think is alarming to people who are not used to these tools is that I think that people need information. There's great community college course, and the first level course is the Project Management 101, and they've got a great book, Crash Course. And so in order to get the vernacular and the structures and the methods in mind, I suggest that we bring that training here so that we can do a 1 hour, 2 hour, get people started on this, because what people don't know is very alarming. So we need some skill building and strength building in these wonderful tools and techniques.
Great, thanks for that comment. Jessica, do we have another one on the online?
Oh, yes, lots of them online. And I'm really just kind of going in order online. So I'm just going by order. Can you better clarify updates to budget versus communication? If staff are to physically move to a different location or report to different people, would that occur more with folks involved in communication or with budget? I'm happy to start on that. So a really good question. I'm sure it's a question on a lot of people's minds, and we don't know the answer to that yet. When we think about the project, I just want to be really clear about the steps we're taking. We are going to vision the future. Then we're going to assess what we have in the organization right now to help us meet that future. Do we have enough resource here? Do we have people who know how to do this, that, whatever it might be, build a TV station? Then we're going to say, okay, what are those gaps? Where do we have holes? And in that section, we're also then going to talk about and how do we structure ourselves to meet that future vision at the same time supporting John's direction around moving away from the matrixed supervision and authorities and moving more to very clear, direct lines of authority. So it's really going to be in that step that we will be able, with that information that we've gathered between the vision and the assessment, where we will be able to make those drafts of what that would look like, who would move where, what does that look like. Then from there, if. And then from there, the question would be, well, how would you implement that? Is that a physical move? Is that not a physical move? Is that, there's just so much there, and we're not starting there. We don't have org charts. We don't have pictures of any of that stuff. That's not where we're starting. We're starting with what is the work and how do we best do it in the future. The other thing that I just want to add, because I think it's really important. The other piece we're trying to bring into this, and we're going to have on all the project work, we're trying to bring our folks who are green belts and black belts in lean and practitioners into this work so they can help facilitate some of these discussions. And so as we're going, they will help us identify those areas so we don't miss the opportunity to lean some of these things as we go. So we're really excited about that as well. So we'll try to build that into this process because, we have 60 days to do all this work. It's going to be great. We're going to add a little more into that, but I think that'll be really good because I hope what we come out of will be more lean in our standardized processes.
60-ish days.
60-ish
All right,
days.
the cat's out of the bag. John can be reasonable when people present with him information that they need more time. Even the question about move is something as an organization we are probably starting to think about a bit differently. The more we go to sort of mobile work environment and shared spaces where you go to where you need to do your work, even the concept of a move starts changing. Yes, there are some people who will always need to have their own queue because the work says, that's the best way to do it, or that's what's needed. But as we get more into the modernized spaces, or whatever we want to call them, the need for moves should be less, because it's about people going to work with their mobile devices and whatever tools they need to what makes sense for the project or the thing they're working on. So we'll see how that plays out, but
we do have a question or a request to re-identify the people in front of the camera. So some people who maybe come on late, so maybe we could just really quickly run through.
Start with you, Jared.
Jared Davis, Assistant Secretary for Disease Control and Health Statistics.
Petula Burks, Director for Center for Public Affairs.
And maybe make sure you guys are close to your mics.
Petula Burks, Director for the Center of Public Affairs.
Clark Halverson, Assistant Secretary, Environmental Public Health.
Amy Ferris, Chief Financial Officer with the Office of Financial Services.
Drew Boughton, Director of Policy and Legislative Relations.
Courtney Dutra, Employee Services.
And again, on the phone, we have Jana Barty, Assistant Secretary for Prevention Community Health. Michael Layer's on vacation, and those of you who were here at the beginning saw Kristen Peterson pop in here, who is the Assistant Secretary for Health Systems Quality Assurance. I think we have a question in the back.
Hello, Meredith Pyle, PCH Office of Family and Community Health Improvement, and a couple questions/considerations. One was, can you speak to the role of subject matter expertise or framework of public administration in this project, in this effort? That, there's an intersection, certainly an overlap between public health or environmental science or HR and public administration, but I'm kind of talking about some pure public administration science, right? Like, is that going to play a major role, like, in your considerations and working out the issues that you're working on? And then my second question or consideration is about the role of customer service. Now, I know a lot of us, I'm more towards the bottom of the hierarchy, which I'm very happy at, but, and we talk a lot about like bottom up customer service, and to do our jobs well, we need to work upwards well in our organization and make sure that we're giving good customer service, not just to the people of Washington, but the people that we rely on in our hierarchy. But also kind of more curious in this instance about top-down customer service, because we also need really good customer service from the agency to be effective in our jobs to serve the people of Washington. So just any thoughts or points on that? Thank you.
Great. Good questions. I don't know that I've given the public administration science all the sort of thought that would be needed, but clearly change management is a part of administration and in how you do that in the public sector and how you organize organizations. So I would love to hear more from you or to those of us afterwards about what you're thinking and what would be helpful and where you see that sort of plugging in. So would love to hear more about that. And customer service, I think part of what I appreciate your question or your piece of frontline staff, what it is you're providing in terms of interface with the public, the customer service you provide internal to the organization, as well as what you need from us higher in the organization to be successful in your job. And that's a bit of what I was talking about, that all of our jobs as supervisors, managers, wherever we are in the organization, our job is to seek that out and hear it and figure out how we help mobilize the resources. Or if we're not able to be clear about that and figure out, so does that mean we have to stop doing something or doing something differently so that we don't just have frustrated employees? And it might be we have too many priorities and we've got to say, well, maybe we need to focus here. Online, maybe another question?
There's a number of people who are asking the question to explain a little bit more your thoughts around what does a matrixed organization look like when you were talking about that, and how do you see the structure being different? Can you explain that in a little more detail or just plain talk it a bit?
Yeah, so matrixed organizations can have various types, but oftentimes in those you have decisions and supervisors who are many people have to buy off on something or have their sort of hands in the pot, and that there's no clear sort of overarching direction that somebody's giving. Sort of here's the goal. Here's what we're all after, and what it is we need from the project or what we need from the team. And I think that's probably some of the biggest thing that's missing here in that. Roles and responsibilities tend to be a bit more clarified in this other structure. That said, project teams are a place where you can bring together all the resources with a clear direction and scope, and then work together to make that happen. So, I mean, right now on the sort of cross-cutting things, we have direction coming from all different places, direction coming from programs, from assistant secretaries, from office managers, from whomever. And it's not necessarily in alignment with each other, or we don't know what the goal is. And so I think that's some of what we're trying to clarify in this. Hopefully that helps.
Does that help the people online who are asking the question or in the room? Like, is that clear? Can I?
Yeah.
Ingrid?
Mike to Ingrid.
It's really simple. You answered part A of that question, but you didn't tell us how this new organization will be different.
Okay, great question. So how the new organization will be different. I think what I did was clearly indicate that for communications and health promotion, overall leadership and direction is going to come from the Center for Public Affairs. So there's a clear place where that is coming from. Budget is going to come from Amy's shop. So there's clear sort of direction and goal setting. That's, I think, what is that shift. And then how we operationalize that is what this operational plan and the project team is about. Thanks for the clarifying question. More online?
Yeah.
We have probably time for one more question.
Okay.
We will collect the questions that have come in online that we don't think we've been able to answer, maybe through what we've already talked about, and then make sure we get those out.
How do you see this change affecting program staff, frontline, non-management, and how will you measure improvements and employee satisfaction aside from the survey?
Survey will be certainly, I think, one of those important things. I think we have an opportunity, and I think maybe we're doing a little bit of this, but I'm not 100% sure, with projects. As we work on a project and as we debrief when a project comes to end or maybe somewhere in the middle, doing that debrief about what's working well, what isn't working well, so we get both that satisfaction as well as capture the lessons learned. And we've been talking a little bit as well about how do we share lessons learned across the organization? How do we share that knowledge base so that it just doesn't stay with that one team? And I think that's what we've got to figure out how to do as well, how we share that, that lessons learned. So I think that's one piece that I would be looking forward to. I'm also looking forward to, I think, the operational plan paying attention to this and building it in. Because I don't feel like I have the right answers, all the answers, maybe it's sometimes any of the answers, but I think you all do.
Yeah, we actually, the one component of our project plan is the evaluation piece. So we will be working on building out an evaluation process that I think will have a number of components, including the employee survey, but I could imagine focus groups, even individual interviews, assessment of work that's happening, but being built into that evaluation cycle. So we will definitely share that as we get that part mapped out. So there'll be that component of the project as well.
So we're what?
I said, we're at time.
Yeah, so we're at time. I hope this was helpful to you all in terms of helping explain a bit about the why and what it is we're trying to achieve. I saw nods in the room that seemed like, okay, I hear that, and I kind of get what you're saying. But please, if you've got more questions, I think you still have a few minutes to get them in. We'll screen those in terms of things we think we might have answered and the ones we haven't, and we'll get information out on that. But this is the beginning. One of the challenges, I think, as in terms of the leadership I'm trying to bring, is we're rolling things out, I think, earlier by saying, hey, this decision's been made. We don't really yet know how we're going to operationalize this. We know we've got to do a planning process. And, you know, one can do that. It creates certain anxieties in different set of circumstances versus somebody planning all of this out in secret and then saying, here's what we're going to do, which has a different set of sort of consequences. I guess I believe the earlier, more transparent place is the way to go. And we want to hear from you about how we best do that, what we can learn from how this rollout occurred or is occurring, because we're all about quality improvement. We're not going to get all this stuff right. Nobody's asking us to get everything right in the organization. But what we want to do is be a learning organization. We want to learn from it, and we want to be able to spread that learning across the organization. So thanks for taking your time out with us, both all of you in the room and those of you who have been online. Hope you have a great weekend. It is wonderful to see some sun again. Thanks.
And if you have questions, feel free, just type in the 2-line DOH agency questions, and we will make sure those get answered as well. So,
and what's
however, that? DOH agency questions.
Great. Thanks, everyone.
Thanks.